Hi, this is Dr. Habib. Today I want to explain how the gallbladder affects memory. It's kind of fascinating. I came across an article that described how a long forgotten medication that supports gallbladder function in producing bile affected mitochondrial function. What they found was that by supporting the biliary system, that's the production of bile, that in a proactive manner altered signals in the microbial flora in the gut. And as a result, the mitochondrial shape and function and energy production increased. And they saw association between that and brain function. In other words, positive finding in relation to, say, dementia or memory impairment. So let's take that thought and just recap a little bit about what I had discussed about how the stomach is such an important area. In fact, the whole gastrointestinal system is probably the core to the entire functioning of the body from head to toe. And the last time I described how the acid in the stomach plays a pivotal role in the way your body releases nitric oxide, and nitric oxide causes blood vessels to open and the blood flow to increase, not only increase in the blood flow in the brain, the heart, but even for erectile dysfunction. And if you can increase the blood flow and have vasodilation, you actually prevent blood pressure or lower it naturally. So talking about the bile, it's the liver that produces the bile. So obviously a highly functioning liver is critical, but let's go back to how the bile and the gut bacterial flora are intertwined. Literally, the bile sets an environment for the gut bacteria to be healthy. But then it's also been noted that the bile itself alters signals in the bacterial flora through what we call toll-like receptors. And toll-like receptors 5 can reduce inflammation in the liver and reverse fatty liver disease. Again, so it's the interaction between the bile and the microbes. On a simplistic level, bile that's produced in the gallbladder is designed to absorb and process fats. But now we realize that it's even more deeper than that. It's setting the environment for the bacteria in your gut to flourish. And what do we mean by that? You get diversity. A diverse gut flora is synonymous with good health. A lack of diversity is synonymous with bad health. Now, there's another analogy between the studies for Alzheimer's. What we found is that even in the brain, you have bacteria. You have a diverse range of bacteria in a healthy brain, and in the Alzheimer's brain, you have a lack of diversity and a preponderance of one type of bacteria called micrococcus. So the gut and the brain seem to have a lot of analogies. So as far as the bile is concerned, it's setting the environment in the gut, it's supporting the bacteria, and it's also signaling to the bacteria in terms of signals with toll-like receptors, and those either turn on inflammation or turn off inflammation. But in particular, they supported the mitochondria in the shape and function and the energy production. There's another analogy between the gut and the brain. It's called the blood-brain barrier and the gut barrier. So when we have a leaky gut scenario, it's highly likely, it's not been proven yet, that there will be a leaky blood-brain barrier. Right now, in terms of experimental ways, we can measure that through elevation in phospholipase A2, an enzyme that is synonymous with leaky or permeable blood vessels. We actually use it as a sign of inflammation in the arteries around the brain, the cerebral arteries, or arteries around the heart, the coronary arteries. But that then leads to what we call an increase in MMP9. That is definitely a sign of leaky blood vessels, and we'll probably find something similar to those markers that will determine if you have a breach in the blood-brain barrier, and I'll just call it leaky brain. So if you have a leaky gut, you'll probably have a leaky brain, just like when you have bacterial diversity or flora in the gut, you also should have bacterial diversity of flora in your brain. And so as far as the leaky brain, As I said, that's my terminology. We have documented lab data that has been studied around seizures. So when seizures take place, right after that, there's a lot of permeability. That means the blood vessels are leaky, and those are synonymous with high levels of phospholipase A2 and MMP9. And so, as I said, that they would be something similar to that will result in identifying breaches in the blood-brain barrier. Now, to continue on the memory decline, what we found with dementia is that there's inflammation. So what is it about inflammation? Why is it taking place? We can only deduce that there's a correlation between lack of diversity of bacterial flora in the brain, which is synonymous with inflammation, and probably likely breach in the blood-brain barrier, leaky blood vessels in the blood-brain barrier. The blood-brain barrier is designed to keep the brain content and fluids and things like that away from the rest of the body. In other words, you just can't have any toxin and any material just waltz its way in and out of the brain. The brain is a very finely controlled organ. The temperature is finely controlled, its electrolytes are finely controlled, and so forth. But what we do know is that there is such a lot of research going on between the gut health and the brain, that whether we talked about the acid in the stomach, now we're talking about the bile, next I'll talk about the further activities of the intestines and how that correlates not only with the brain but cardiovascular function, probably even cancer. And so talking about the memory again, is that what we realize is that healthy gut is probably one of the prerequisites to a healthy brain. So another analogy is this: when people have signals that are inflammatory, they create what we describe immune cells that are synonymous with insulin resistance. In other words, the insulin that's in your body is not as effective. So what tends to happen is that within the body tries to produce extra insulin, and that higher insulin levels can turn on inflammation. So those immune cells are interleukin 1, interleukin 6, interleukin 12, interleukin 23, and they are synonymous with insulin resistance. Now, look at the analogy between that and what goes on in the brain. We find that in the Alzheimer's brain, there is higher levels of interleukin 1, 6, 12, and 23. So very synonymous with the similar immune cells for insulin resistance. And when I say that there's resistance to insulin, what I mean is that the body tries to compensate by making more insulin, and that is another way that inflammation takes place in the brain, and that is a prerequisite to a decline in cognitive function, which in some cases, in many cases, can lead to Alzheimer's disease. So insulin resistance is now postulated as the driving force of, say, or associated with fatty liver, a driving force of memory loss and dementia, and a driving force of cardiovascular problems. That's the connection. Not only is the gut the connection, but now we're finding a more and more correlation between immune cells, insulin resistance, and how they are connecting all these organs together. So instead of therapy for the brain, which is separate for therapy for the heart and is separate for therapy for the gut, we find the connection, and we may actually find therapies that are common for all three things all along, also respecting that each one is a discrete organ, but combining the thought process of individual organ systems and what they need, plus the things that are common to all of them, you get better results. So I'll finish on this note. When you in an isolated manner control blood pressure, cholesterol, and blood sugar, you reduce the risk of cardiac disease by, say, 25%. That's not very impressive. But if you understand that there's insulin resistance and there's inflammation, you are more than likely going to get much bigger reductions in heart disease like I get. I get up to 70% reduction because I address the current standard, which is address individual risk factors like high cholesterol, blood pressure, blood sugar. In addition, I look at insulin resistance, I look at inflammation, because those are common to the gut system, they're common to the liver system, they're common to the heart, they're common to the brain. So when you combine those two together, not only do I get much bigger reductions in heart attack, but I will probably be able to show that I can slow down and probably reverse dementia and cognitive decline, and I can also reverse fatty liver disease, and in the process, I will make the gut more healthy.